Do you know that you have the power to save a life? I learned this in my early 20s. I had just finished my master's degree in mental health, and I had this idea of traveling around the world with a backpack on my back. I was ready to experience all that life had to offer. I planned on working along the way, and I quickly found myself signing up for a job in New Zealand on a sheep farm. I know. Well, I had this ridiculous notion that I wanted to have a sweater that was made from the wool of a sheep that I myself had shorn. And when I arrived at the farm, I was greeted by a woman who was not at all welcoming. In fact, she was downright rude. And I remember this pit in my stomach thinking, I think I've made a terrible mistake. But I was quickly rushed off to the barn, where I was greeted by the most awful sights and sounds and smells, because clearly I had not thought this through. And I was immediately put to work, and within moments, I was managing the fleece. I'm gonna be honest, I really don't remember much about those hours, other than I've never been so dirty, tired, or sore in my entire life. And 7 hours later, I crawled my way back up to the front porch where I sat bleeding, terrified that I had made this 2-week commitment, and literally in tears. And just when I thought it really couldn't get any worse, a young girl went blazing by me, and she picked up a bucket of slop water, and she threw it all over me. And so I was totally drenched and completely in shock. And I could hear her mom screaming behind her, and there I was face to face with the woman who had barely greeted me a few hours earlier. And then she began to cry. And so I remember trying to console her, and it took her a minute to catch her breath. She apologized for what her daughter had done. And then she shared with me that she was overwhelmed and that she felt like a terrible mom. And in that instant, I felt so connected to her, because I had spent the entire day feeling overwhelmed and inadequate, but I also felt compassion. Compassion for how difficult it is to raise a child with special needs. I also remember thinking, now I understand why I was brought to this farm. It wasn't my sheep shearing skills. I was brought to the farm because I studied mental health. And I shared that with this mom. I had a certificate program in children on the autistic spectrum. And when I shared this with Mom, my newfound role on the farm was created. I became her family coach. So I'm not gonna lie to you, Daisy was a handful. And at 4 years old, she was in charge of everything. Every cabinet was rigged and every faucet was locked because she got into everything. So over the course of the 2 weeks that we were there, we spent a lot of time talking about behavior charts and schedules. We talked about diet and physical activity. And at some point, Mom said to me, could you please watch Daisy so I can just have a few minutes to myself? I want to go run some errands by myself. It turns out Mom had not had a moment to herself since Daisy was born. And she was experiencing depression. And just giving her that space made all the difference in the world. So 2 weeks went by pretty quickly. But before I left the farm, we put together a plan so that Daisy's mom could get the support that she needed. Her friends agreed to come over once a week and spend time with Daisy so Mom could have respite. And that social support and social connection made all the difference in the world for Daisy's mom. It was a game changer. And so it took a lot of courage for Daisy's mom to share with me about her mental health condition, and that inspired me. It inspired me to make a difference in the mental health space. Upon my return to the US, I worked in the children's mental health space, studying wraparound and utilizing wraparound in communities, which focuses on creating support systems. And then later in my career, I received a doctorate in public health, where I focused on the prevention of diagnosable mental health conditions. Because these days, we're experiencing a global mental health crisis with over 1 billion people struggling with their mental health. Further, the CDC estimates that 1 out of every 2 people will experience a mental health condition in our lifetime. And with numbers like this, there aren't nearly enough counselors to meet the need. The problem is, though, we're relying on these formal treatment services to solve our current mental health crisis. And what we're doing isn't working, because 1 out of every 100 deaths is a death by suicide. If you think about the time that I've spent researching for the past 20 years, and how we're struggling with this mental health situation, I've really come and landed on the space that we are the solution to the mental health crisis. Everybody in this room and everything that we do. If you think about Daisy and her mom, did her mom need medication or therapy to solve her problems, or could have an active support system helped mom's mental health? And there are thousands of people like Daisy's mom out there that every day are struggling with something that they have very little control over, but they do have control over the people they allow into their world to support them. And I call these the social influences of mental health. These influences are based in science, and there's extensive research that the social aspects of our lives improve our level of happiness. The trick is, how do we intentionally use these influences in meaningful ways? I research social connections, social support, social capital, social media, and social inclusion and social justice. If you think about the people in your life who are struggling, because these days we all know somebody who's struggling with mental health, how could you be more supportive, or how could you be more connected? Could you pick up the phone and call them, or maybe just send a text that says hi? And if you're the person who's struggling, how can you allow somebody in? How can you have the courage to allow somebody in to support you? When I think back to my time in New Zealand on that sheep farm, I know I didn't solve all the problems of Daisy's family, because autism isn't like that. But I do know that I was able to put together a plan, provide the caregiver with the support that she needed to raise a child with special needs. And I know that she really appreciated it, because when it was time for me to leave, she gifted me with a sweater made from the wool of the sheep that I had shorn. Thank you.